Hi, my name is Jane Morton, and I'm going to talk you through our three-part presentation on Welcome to Medicare for people starting Medicare. I work for the Area 6 Agency on Aging. We're located in Polson at 110 Main, Suite 5, and we serve Lake, Lincoln, Mineral, and Sanders counties and the Flathead Reservation. You can call us. Our local number is 883-7284, or our toll-free number is 1-800-551-3191. I'm a SHIP counselor. SHIP stands for the Montana State Health Insurance Assistance Program. SHIP counselors are trained and certified by the state of Montana to help people with Medicare issues. Again, you can call us at 1-800-551-3191, or we have another toll-free number that's just for our office, our local number. We have four SHIP counselors in the office in Polson, but we also have SHIP counselors who live in Lincoln, Mineral, and Sanders counties. And you can call the Polson office and we'll put you in touch with one of them. You can also call the Social Security Administration for information about Medicare. Here are the two numbers for the Missoula and Kalispell offices. First of all, what is Medicare? Medicare is a health insurance program. A lot of people confuse it with your Social Security retirement benefits, but they're two different things. So Medicare is a health insurance program. It's mainly for people who are 65 and older. But there are some people who can get Medicare under 65, and that includes people who have end-stage renal disease, ALS, which is Lou Gehrig's disease, asbestosis up in the Libby area, or you're put on disability for any reason and you've received Social Security disability or railroad disability for 24 months. In the 25th month you can get Medicare. But for most of us it's when you turn 65. This series, parts 1, 2, and 3, we'll talk about the basic parts of Medicare. Part A is your hospital insurance, Part B is your medical insurance. Part C is an optional way to get Medicare, and Medicare Advantage plans are pretty much the only option in our area. And then Part D is prescription drug insurance, and we'll also talk about supplemental plans or Medigap insurance. When you are starting Medicare, you have some choices of how to get your coverage. In Part A, or excuse me, in Section 1 of our three-part series, I'm going to talk mostly about original Medicare. That's this side of this diagram. And in Section 1, I'm just going to talk mostly about Part A and Part B. A lot of the reason that people have their Social Security retirement confused with the Medicare health insurance program is because Social Security is who collects the payroll taxes during your working life, and then they determine your eligibility, enroll you, and issue you your card. They also can help you with other information, and they have an assistance program we'll talk about later. But once you're signed up for Medicare, Social Security doesn't handle any billing or coverage issues or payments. That's all the Centers for Medicare and Medicaid. So a lot of people call and say, well, I'm almost 65, when do I sign up for Medicare? For most people who are new to Medicare, you have an initial enrollment period having to do with the month you turn 65. It starts 3 months before your 65th birth month and ends 3 months after your 65th birth month. For people who work past age 65 and have employer-sponsored health care, you may not want to get all of your Medicare at this time, so you can delay part of it, and then you have a special enrollment period that lasts for 8 months after your employment ends or your employer insurance ends. This diagram just shows your initial enrollment period. For the 3 months prior to your birthday month, if you sign up during those 3 months, your Medicare will start on the first of the month you turn 65 and there will be no delay. If you wait and sign up during your birth month or in the 3 months following your birth month, the start of your Medicare will be delayed till 1 month or 2 months or 3 months later. If you miss your initial enrollment period or your special enrollment period when you stop working, you can also sign up for Medicare during the annual general enrollment period. In January, February, and March of each year, people can sign up for Medicare. However, if you miss your other enrollment periods and you have to wait for the general enrollment period, then your coverage will not start till the following July 1st. And that may delay it long enough to have a late enrollment penalty. We'll talk more about late enrollment penalties later, but it's definitely something you don't want to have. Okay, how do I go about starting Part A? Most people automatically get Part A. If you're already drawing your Social Security or your railroad retirement, or if you've been receiving Social Security disability income for 24 months, they automatically sign you up and they send your card in the mail, and you'll get your Medicare card about 3 months before your 65th birthday or your 25th month of disability. Your card looks like this. It's not like a credit card or driver's license, hard plastic. It's more like your Social Security card. It's a smaller, just flimsy cardboard card. It comes in the mail, attached to the corner of a larger card. We've had a lot of people actually throw their Medicare card away because they just think it's junk mail. When you're turning 65, you are bombed with all kinds of junk mail from insurance companies trying to get you to go with them. And so watch your mail carefully, because you might get your Medicare card in the mail. Well, you will get it in the mail whether it's automatic or whether you enrolled for it. So what do I do if I don't meet the automatic criteria? These days, with the full retirement age for Social Security being more than 65, most people aren't usually retired yet, and so a lot more people are not drawing their Social Security yet, and so they fall into this category. If you're not automatic, you have to actively enroll to get Medicare. You can visit the Social Security office or call the Social Security office, or you can just go online at www.ssa.gov and enroll online, and we help a lot of people do this in our office. Most people are entitled to get Part A with no monthly premium or premium free. because they paid payroll taxes. If you have at least 40 quarters, which is about 10 years of work experience where you paid payroll taxes, then you don't have any premium to pay, and you don't also have to worry about a late penalty. However, if you don't qualify for premium-free Part A, but you want to pay a premium to get Part A, you can still sign up for Medicare and pay a premium, but you have to be careful of having a late penalty. Medicare Part A is called hospital insurance, and it helps pay for hospital stays, skilled nursing facility care following a hospital stay, home health care, or hospice care. Generally, you have criteria that you have to meet, whether it has to be prescribed by a doctor, minimum 3-day hospital stay. You usually also have deductible to pay or copay to pay. You do have certain rights and protections if the coverage is denied, that you can file a complaint. I can't think of the word. Okay, hospital stays. When you get put in the hospital, if you're on original Medicare, you have a deductible of $1,408, and that's a per benefit period deductible. Once you get in the hospital, no matter how long you stay in the hospital, you only have to pay that deductible once. But if you're in the hospital and then you get out, and you're out for more than 60 days, and then you have to be hospitalized again, you could have to pay this deductible more than once in a year. Because if you've been out 60 days, it's a new benefit period, so you pay a new deductible. Also, there are co-payments. Now, when you go in the hospital, you pay the deductible, and then for days 1 through 60, there are no co-payments for your hospital bill. Everything's covered. But if you are there for a long period of time, continuously, for days 61 through day 90, you have a copay of $352 a day. And if you're still there after 90 days, for day 91 through day 150, your copay is $704 a day. And this last one, for 91 through 150 days, is a lifetime benefit, meaning they'll only pay for longer than 90 days once in your lifetime. Medicare Part A also pays skilled nursing facility care. This is not long-term care, as in someone has to move to a nursing home. This is rehab care after a minimum 3-day hospitalization. And under Part A, the first 20 days are covered in full. If you have to be there longer than 20 days, for days 21 through 100, you have a copay of $176 a day. After 100 days, Medicare Part A won't cover that anymore. All your Part A coverage is used up. So, and also if only personal care is needed, it will not be covered by Medicare. I'd also like to mention right now that when you are hospitalized, it's really important to know if you have been admitted or if you are just under observation. And they can actually keep you overnight and still say you're under observation. In order for Medicare Part A to cover skilled nursing care following your hospital stay, you have to have been in the hospital under admitted status for a minimum of 3 days. So if you've been in the hospital, but you don't, you weren't admitted for 3 full days, Medicare won't pay for any skilled nursing care. Medicare Part A also covers home health care, and again that has to be ordered by your doctor, and then it only is for intermittent skilled care. No one's going to come stay at your house 24 hours a day or anything like that. It's not going to be covered by home health care. It's going to come out of your pocket. But home health care will cover intermittent skilled care that's ordered by a doctor. It covers things at 100% except for durable medical equipment. Usually durable medical equipment is covered at 80% and you have to pay 20%. Medicare Part A also covers hospice care. If you are diagnosed with a terminal illness, you can choose to have hospice care rather than care that tries to cure you of your disease. Generally people go home under hospice care and then they have home care. Again, it has to be certified by a doctor, and this doctor has to have seen you face to face to certify this. A lot of people think that, well, you have to live for less than 6 months, so they don't get hospice care right away. The doctor can recertify you no matter how long you live. So if you are diagnosed as terminal and you want to go the hospice route, you don't have to wait. The sooner that you get hospice, the sooner they can start helping you. And they are a lot of help. Part A is hospital coverage. Part B covers medical expenses that are not inpatient. Most of us have most of our expenses in Part B because doctors, labs, things like that. Usually when you enroll in Part A, you enroll in Part B at the same time. However, you have an option to enroll in just Part A, or if you're automatically enrolled, they will put you on A and B, but there's an option to decline Part B, and it's on the back of your Medicare card. We'll talk about why you might want to do that a little bit later. Here are some of the things that Medicare Part B covers: physician services, outpatient hospital care, labs, equipment, supplies, ambulance. The thing at the bottom there, annual visit and personal prevention plan, you have to be careful with those because those are not a physical. An annual visit, you know, they take your temperature and your blood pressure and your weight and some things like that, but if you complain of like a problem breathing and they do a chest x-ray, or a problem with your stomach and they do some kind of test on your stomach, that's not included in your annual visit. So you would pay 20% of that cost. Medicare Part B doesn't cover any vision or dental or hearing aids. It also doesn't cover routine foot care, and it does not pay for long-term care. A lot of people assume that if they have to have long-term care that Medicare is going to cover that, and then when they get to that point they're really surprised. So you need to know from the beginning that Medicare Part B does not cover long-term care cost. Medicare Part B does have a monthly premium, and that is $144.60 a month. For most first-time enrollees, that's the cost in 2020. However, if you're in one of the higher income brackets, your Medicare premium will be higher. And if you want a schedule of those brackets, we can certainly send that to you. Medicare Part B does have a deductible. It is an annual deductible, so you only have to pay it once a year, and it's $198. So you have to cover the first $198 of your medical care cost in a year before Medicare starts to pay. Then generally everything that's covered by Medicare is covered at 80%. And your co-insurance, the part you pay, is 20%. If you have difficulty affording that monthly premium for Medicare, there are assistance programs through the Office of Public Assistance called Medicare Savings Programs. You have to, of course, be on Medicare and have a Social Security number. And then there are resource and income guidelines. The QMB, or Qualified Medicare Beneficiary Program, if you qualify for that, will pay for any Medicare premiums, Part A and or Part B, and any deductibles or co-insurance. Of course, it has the lowest income and resource guidelines. Then the other two programs, the Special Low-Income Medicare Beneficiary and the Qualified Individual Program, just help you with that Medicare Part B premium. These are the income and resource guidelines for a single person or a couple in 2020. Medicare Part B also covers a lot of preventive benefits at 100%, like flu shots or pneumonia shots or mammograms or colonoscopies. That one up in the corner here, physicals, that's a little misleading because it covers those annual wellness visits, but not a complete physical. That's the end of part 1 of our Welcome to Medicare series. And again, we are the Western Montana Area 6 Agency on Aging.